Nosebleeds, medically known as epistaxis, are common occurrences that usually do not warrant alarm. It's a phenomenon that many of us have encountered at some point in our lives, whether it's a minor trickle or a more concerning gush. But more often than not, nosebleeds are harmless, more a nuisance than a medical emergency. Now let's talk about why these nosebleeds happen. The inside of our nose is lined with a multitude of delicate blood vessels, which, when disturbed or damaged, can bleed. This disturbance can come from a variety of sources. Dry or cold weather, for instance, can cause the nasal membranes to dry out, leading to nosebleeds. This is why you might find yourself reaching for a tissue more often in the winter months or in arid climates. Allergies too can be a trigger. They can cause inflammation and irritation in the nasal passages, making the blood vessels more prone to bleeding. The same goes for respiratory issues, such as sinusitis or bronchitis, where the repeated blowing and wiping of the nose can lead to nosebleeds. Irritants are another common cause. This could be anything from smoke and pollution to certain medications and recreational drugs. These irritants can damage the nasal lining, leading to a bleed. But it's important to remember that nosebleeds, while common, are not always innocent. They can sometimes be a symptom of an underlying health condition. That's why it's essential to understand them, to know when they're just an annoyance and when they might be indicating something more serious. While nosebleeds are usually harmless, understanding their causes and types can help us manage and prevent them effectively. A nosebleed can be triggered by numerous factors, some of which are within our control. Let's delve deeper into the various causes of nosebleeds. The first one, and perhaps the most common, is the weather. Dry or cold conditions can cause the delicate skin inside the nose to crack and bleed. This is especially true in winter months where the air is often drier, both indoors and out. Using a humidifier can help keep your nasal passages moist and less likely to bleed. Allergies are another frequent cause. These can lead to inflammation and irritation in the nose, making it more susceptible to bleeding. Whether it's pollen, dust, or pet dander, allergens can cause the nose to become itchy and inflamed, leading to frequent nose rubbing and eventually nosebleeds. Respiratory issues, including colds, sinus infections, and even the common flu, can also result in nosebleeds. The constant nose blowing associated with these conditions can irritate the nasal passages, causing them to bleed. Irritants such as cigarette smoke or strong odors can also provoke nosebleeds. These substances can dry out or irritate the nasal membranes, making them more prone to bleeding. Even overuse of nasal sprays can have the same effect. Let's not forget that certain medications and health conditions can exacerbate nosebleeds. Blood thinners and non-prescription drugs like aspirin can increase the risk. Health conditions that affect clotting, like hemophilia or liver disease, can also make nosebleeds more likely and potentially more serious. In some cases, nosebleeds can be a sign of high blood pressure or a symptom of a more serious health issue. It's always important to consult with a healthcare professional if you're experiencing frequent or severe nosebleeds. Recognizing these triggers is the first step towards effective nosebleed management. Nosebleeds are not all the same. They can be categorized into anterior and posterior nosebleeds. Let's start with anterior nosebleeds. These are the most common type that many of us have experienced. Imagine the inside of your nose as a house. The front part, or the living room, if you will, is where anterior nosebleeds happen. They occur at the front of the nasal septum, the wall between the two nostrils. This area is densely packed with blood vessels, and when they rupture, it causes a nosebleed. It could be a swift blow to the nose, a sneeze that's a little too powerful, or even the dry winter air that causes these vessels to bleed. But the good news is, anterior nosebleeds are usually not serious and are easier to manage. A bit of pressure and patience, and you're good to go. Now, let's venture into the back room of our nasal house. This is where posterior nosebleeds occur. They're less common but more complicated. These nosebleeds originate deeper within the nose, where the arteries that supply blood to the nose are located. Because of this, they can produce a heavier flow of blood. Unlike their anterior counterparts, posterior nosebleeds are not as easy to treat at home. They often require medical intervention as the bleeding can be more difficult to control. So why does this distinction matter? Well, understanding the type of nosebleed you're dealing with can help guide your response. If you've got an anterior nosebleed, you may be able to handle it yourself. But if you suspect a posterior nosebleed, it's important to seek medical attention. In both cases, remember not to panic. Nosebleeds, while inconvenient and sometimes a bit startling, are usually not dangerous. But knowing the difference between an anterior and a posterior nosebleed is a useful bit of knowledge that can help you navigate these unexpected moments with a bit more confidence. Understanding the type of nosebleed one is experiencing can guide the appropriate response and treatment. While nosebleeds can be startling, knowing how to respond can make all the difference. Let's delve into the primary treatment methods for nosebleeds. Firstly, applying pressure to the nose is the go-to initial response. It's an age-old method that still stands the test of time. Here's how it works. You sit upright, lean forward slightly to keep the blood from going down the back of your throat, and then pinch the soft parts of your nostrils together. This action applies pressure to the bleeding point in the nasal septum, helping the blood to clot and stop the flow. Now, on to the second method, using a cold compress. This is another simple yet effective treatment. Just apply a cold pack or a bag of frozen veggies wrapped in a thin cloth to the bridge of your nose. The cold helps constrict the blood vessels, which slows down the bleeding. Avoiding certain actions is also crucial in treating nosebleeds. One might instinctively want to blow their nose to get rid of the blood, but resist that urge. Blowing your nose can dislodge blood clots that have formed, leading to more bleeding. So keep calm. Carry on with the pressure application and let your body do its job. These methods are usually sufficient to stop a nosebleed. However, there are caveats. If the nosebleed persists for more than 20 minutes despite these efforts, it's time to seek medical attention. Similarly, if the nosebleed is accompanied by other symptoms such as dizziness, fainting, or abnormal heartbeat, don't delay in getting to a healthcare provider. These could be signs of a more serious condition. So there you have it. Treating nosebleeds is primarily about staying calm, applying pressure, using a cold compress, and avoiding actions that could exacerbate the bleeding. Remember, while nosebleeds can be a bit unnerving, they're usually not a cause for alarm. However, persistent or severe nosebleeds warrant medical attention. With the correct response, most nosebleeds can be managed effectively at home. Persistent or severe nosebleeds may indicate an underlying health condition. This statement, though alarming, is not intended to cause panic, but to emphasize the importance of understanding what our bodies are trying to communicate. Often the body uses symptoms like nosebleeds as a way to signal that something is off balance. While nosebleeds are usually harmless, persistent or severe nosebleeds may warrant further investigation. This is where the role of diagnostic tests, such as blood work and imaging scans, comes into play. Imagine blood work as a detective, sifting through the evidence to find clues about what's happening in the body. It can reveal if there's an issue with clotting, which could be causing the nosebleeds, or it might show signs of a blood disorder or other systemic conditions. Similarly, imaging scans like CT scans or MRIs act as a magnifying glass, giving doctors a detailed view of the nasal area to check for any abnormalities or injuries that could be contributing to the nosebleeds. But remember, these tests are not a cause for concern. They are tools that healthcare professionals use to gather information. The aim is to identify any potential underlying causes and then address them. This could involve adjusting a medication that's causing the nosebleeds or treating a health condition that's been discovered. The key takeaway here is that if your nosebleeds are persistent, severe, or accompanied by other symptoms, it's important to seek medical attention. It's not about jumping to conclusions or fearing the worst. It's about taking a proactive approach to your health. And let's not forget, sometimes the cause might be as simple as dry air or an allergy, both of which can be easily addressed. But it's always better to know for sure, isn't it? Identifying and addressing any underlying causes is crucial to preventing recurrent nosebleeds. So listen to your body. Take note of the signs it's giving you, and don't hesitate to seek professional advice when needed. Prevention, as they say, is better than cure. This holds true for nosebleeds as well. Rather than waiting for a bleed to start and then rushing to stop it, Wouldn't it be more convenient to prevent it from happening in the first place? Here's how you can do just that. First and foremost, using a humidifier can make a world of difference. By keeping the air around you moist, a humidifier prevents the drying out of your nasal membranes. This is particularly useful in dry or cold climates where the air tends to be less humid. But what if you can't control the climate around you? Or what if you're constantly on the move? Well, there's a solution for you too. Saline nasal sprays or gels are portable options that help to maintain moisture in your nose. They can be used as often as necessary and are generally safe for all ages. Another preventive measure is to avoid nose picking and excessive nose blowing, which can irritate the nasal lining and lead to bleeding. If you have allergies that make your nose itchy or cause you to sneeze often, addressing these with appropriate medication can also help prevent nosebleeds. Remember the triggers we discussed earlier? It's crucial to address these. If dry air is a trigger, use a humidifier. If it's an allergy, consider antihistamines. If it's a medication causing your nose to dry out, talk to your doctor about possible alternatives. Staying hydrated by drinking plenty of fluids can also help keep your nasal membranes moist. And let's not forget the importance of a healthy diet. Foods rich in vitamin K, which aids in blood clotting, and vitamin C, which strengthens blood vessels, can help in preventing nosebleeds. In a nutshell, the key to preventing nosebleeds is to keep the nasal passage moist, avoid irritants, and address any known triggers. These measures, coupled with a proactive approach to your health, can significantly reduce the frequency and severity of nosebleeds. Remember, it's always easier to prevent a problem than to fix one. A proactive approach can significantly reduce the frequency and severity of nosebleeds. Now, let's address some common questions about nosebleeds. To start us off, one frequently asked question is, are nosebleeds a sign of a serious health problem? The answer is usually no. Most nosebleeds, particularly those occurring at the front of the nasal septum, are not a cause for concern. However, if you experience persistent nosebleeds or if they're accompanied by other symptoms, it may indicate an underlying health issue. It's always best to seek medical advice in such instances. Another question we often hear is, what triggers a nosebleed? Several factors can lead to a nosebleed. Dry or cold weather, allergies, respiratory issues, or exposure to irritants can all be culprits. Even the simple act of blowing your nose too hard or picking it can cause a bleed. Moving on, why won't my nosebleed stop is a common concern. Remember, the key to stopping a nosebleed is applying pressure to the nose and using a cold compress. If the bleeding persists for more than 20 minutes, it's time to seek medical attention. The question, are some people more prone to nosebleeds than others, also comes up frequently. The answer is yes. Certain medications and health conditions can make a person more susceptible to nosebleeds. Furthermore, the likelihood of experiencing a nosebleed can increase with age. And lastly, how can I prevent nosebleeds? Prevention methods include keeping the nasal passages moist, especially during dry or cold weather. Using a humidifier and applying a saline solution or a water-based lubricant can help. Understanding nosebleeds can help us respond effectively and reduce their impact on our daily lives.